Hi guys, my name is Niyati and welcome to this Chegg video tutorial. I'm a tutor here on Chegg Tutors and I mostly tutor biology and medicine related subjects. And today in this video, I'm going to be talking to you a little bit about the interventions that we use for the treatment of congestive heart failure. Now, if you've seen some of my previous videos, I've spoken to you a little bit about what CHF is, what the causes are, some of the signs and symptoms, and some of the medical treatment that we use to treat it. Now, in this video, I'm going to talk to you a little bit about more invasive methods. And these are certain methods that we use when the lifestyle changes and the medications haven't helped, or if the patient is always symptomatic all the time with symptoms of heart failure, and if it's really badly affecting the patient's quality of life. In such situations, we can use more invasive methods to treat CHF. So, getting started, the first one is called a VAD, or a ventricular assist device. And this is basically a pump or a device that takes over the function of the failing ventricle. This can either be an LVAD, L stands for left ventricle, or it can be an RVAD, and R stands for right ventricle. Or it can be BIVAD, biventricular, depending on if one or both ventricles are failing. So this pump basically bypasses the failing left ventricle and pumps for it. And this is one of the devices that we can use either as a bridge to heart transplant for people who are waiting to get a heart transplant, or in some people who cannot have a heart transplant, this is just a long-term solution that they use for heart failure that is not responding to lifestyle changes or medications. The next kind of device that we can use is called cardiac resynchronization therapy, and this can be either a pacemaker alone or it can be a pacemaker along with the defibrillator. And the reason we use this is because a lot of times what happens in heart failure is that the ventricles are not pumping in synchrony with each other, and this greatly reduces the efficacy of the already failing heart. And this kind of increases the oxygen demand more and more, and this is just not energy efficient at all. So in order to control this, we use a pacemaker, which kind of sets the rhythm of the heart, or we use a defibrillator that shocks the heart back into sinus rhythm when the ventricles are not pumping in synchrony with each other. So that's one of our other aims of heart failure treatment, and the cardiac resynchronization therapy can help with that. Moving on, there are certain things that we can implant into the patient. For example, stenting is one of the methods that we use to treat CHF caused by atherosclerosis or coronary artery disease or ischemic heart disease, which is one of the major causes of CHF, as I mentioned in one of my previous videos. So in stenting, what we do is we take this metal tube that's kind of flexible. It opens up and you put it into the lumen of the artery, and what the stent does, it stays in the artery and it pushes the plaque up against the walls of the artery so as to make the lumen of the artery patent again, so as to allow for sufficient blood flow and perfusion to the coronaries. So the stent is kind of like something that holds the artery open when it's been blocked by atherosclerosis and block. CABG is basically stands for coronary artery bypass grafting, and this is a pretty major surgery that involves grafting an artery or a vein from another part of the body and using it to bypass an already blocked coronary artery. So instead of putting a stent in, you just take another blood vessel from another part of the body where it won't really make a difference if that blood vessel is taken from that part or not. Like mostly it is taken from the lower limb, veins from the lower limb, or arteries like the internal mammary artery are used, and it's used to graft around the blocked coronary artery. Another thing about stents is that some of the stents are coated with antiplatelet medications that prevent the stent from that are supposed to prevent the stent from getting clotted again. And the last method that we use is like the ultimate surgical intervention for CHF, and that is a heart transplant, where the failing native heart is replaced by a healthy donor heart. And this is kind of like the ultimate treatment for end-stage heart failure, and this is used when all the other treatments and other medications have failed. So this is kind of your last option, which is a heart transplant. So that kind of gives you a brief overview of the interventions and more invasive techniques that we use to treat heart failure. I hope this video helped. I hope you learned from it. I hope you enjoyed watching it. My link to my Chegg Tutor profile is down below in case you have any more questions. You can feel free to ask me on there. And thank you so much for watching, and have a great rest of the day. Bye!